Hello, my name is Chris Parham, and this is my final thesis presentation for Design Seminar 2 for the DMI. And the name of my project is called From Reconstruction to COVID-19. You are on your own again. Basically, how the medical profession makes Black people sick through healthcare inequality that dates back to slavery. And my project will basically deal with how, starting at Reconstruction and going up until COVID-19, how Black people have fared in the medical industry and how the medical profession has always been tied to slavery. And in my abstract, my thesis deals with healthcare inequalities for former slaves and their descendants from the time of Reconstruction to COVID-19, and how the medical profession has been tied into slavery since before Reconstruction, and how Blacks have been discriminated against in treatment, medical outcomes, lack of urgent care compared to whites, and vaccine issues associated with COVID-19. So my categories deal with Reconstruction, medical experiments, homemade remedies, 1918 influenza epidemic, the Tuskegee experiments, Henrietta Lacks, the AIDS crisis, Hurricane Katrina, Obamacare, COVID-19, and my conclusion. So, for instance, what you're looking at on this page are the practical rules for having a slave. And these were actual booklets that were written by slave owners as well. And they came with categories and so on, and these things specifically dealt with how to deal with your slaves medically, and so on. And again, healthcare after Reconstruction, slaves who were now free after emancipation dealt with major health issues due to working 12-hour days in the cotton fields. And they dealt with health issues such as yellow fever, typhoid, depression, malaria, and other diseases as a direct result of their master's cruelty. But now, economically, owners felt no responsibility for their former slaves because the insurance policies, in most cases, cost more than the slaves itself. So, to your left, you're seeing a slave plantation with slaves, and to your right, you're looking at an insurance policy that was used, for instance, for slaves, with some of the most famous names of insurance companies like Aetna, New York Life, Metropolitan Life, and John Hancock that were that had primary things on slaves, insurance policies, that is. And the Freedmen's Bureau, for instance, was the Bureau of Refugees, Freedmen, and Abandoned Lands, also known as the Freedmen's Bureau, began as a U.S. government agency from 1865 to 1872 to help with lodging, food, medical care, and labor to help newly freed slaves and their families. So the Freedmen Bureau, it didn't last that long, but it was basically set up to help freedmen get basically back on their feet. But with racism happening at that time, especially at the end of the Civil War and the loss of the Civil War in the South, there was a lot of anger and towards Black people because, again, like I say, former slave owners did not feel any kind of responsibility for their slaves at all. And there were also unethical experiments on Black women. So, for instance, a doctor named James Marion Sims, who was known as the father of modern gynecology, he did experiments on women, enslaved women, especially one that you're seeing right there named Sally, who was experimented on for at least 30 times. And these experiments were basically done for white supremacy. These experiments basically dealt with the fact they were trying to prove that Black people were inferior to whites. So white people had a reason and an excuse basically for justifying, and especially using the Bible on Black people and why these experiments were necessary. And again, this deals with the whole idea of how Black people have always been treated by the medical profession, and that they were always treated again as experiments, and they were used that way as well. And experimenting with Black bodies for the better health outcome of whites, that was kind of like the basic idea behind these kinds of experiments. They basically, the slaves had no say in their medical treatment or anything like that. So a lot of times, masters would play doctor and nurse with their wives, that is, in order, to avoid paying real doctors who didn't want to treat the slaves anyway. So the health of the slave was crucial for profit, and the inhumane experiments on slaves was to prove white supremacy again, that Blacks were inferior to whites in every way. So that was one of the reasons why they did these kinds of cruel experiments, especially without anesthesia, especially on women. And they did all kinds of really weird experiments on women and on men as well. And a lot of the slaves dealt and had homemade remedies. For instance, homemade remedies were brought over with enslaved Africans, and they were on beads and chains. And the herbs and the roots consisted of boneset, for instance, which was used for the common cold, and also sage was used for treating sore throats and also to treat colic in infants. And since slaves were always exposed to the elements, they frequently had respiratory and intestinal diseases. And they also used herbs and roots for birth control. So the homemade remedies were used for a lot of different things, and slaves relied on those more than anything. And a lot of times they would be, use these homemade remedies for all kinds of things, from the common cold to, again, birth control, to treating colic, especially for people who had to work out in the fields for 12-hour days. That's where this sicknesses basically came from, is from working in the fields. And the homemade remedies, they were using those up until the time they wanted to go to medical school. That is, black people. That is. So, for instance, homemade remedies versus the right to learn medicine. And as more freed blacks realized that the American system of medicine will not let them become doctors and nurses, in order to create their own schools and hospitals, they had to let go of the natural ways in which freed slaves used homemade remedies, because without a license, they could not practice medicine. But some former slaves relied on slave medicine, seeing it got them through the horrors of life before and after slavery. But the thing is, what they had to do was, freed blacks ended up doing a lot of fundraising. They built hospitals. They started hospitals at the HBCUs, historically black colleges and universities. They started training nurses as well. So they had to basically set up their own systems in order to get recognized, but they also had to go through the American medical system, which discriminated against them for years, and still does to this day. But they had to basically do their own thing in order to become freed black. Freed blacks had to basically create their own hospitals and so on. And then, for instance, once the 1918 influenza epidemic happened, during the summer of 1918, an influenza epidemic hit the United States, killing over 100,000 people. But black people during the months of September, October, and November had lower morbidity and also lower mortality rates. But the caseload for fatalities was much higher than the white population, and the reasons remain unclear, and results may imply that if exposed to the epidemic, they had a much higher risk of dying. So just like with COVID-19, back then, black people couldn't go to hospitals because hospitals were segregated. They couldn't, again, go to nursing schools or anything like that. And they basically were sent home, just like what's happening today, for instance, when COVID happened. And that's why I kind of make the comparison between when COVID happened, people were sent home. They couldn't, and a lot of people, a lot of black folks especially, with this influenza epidemic, I compare the two because black people were not given the vaccine in the same rates as whites, and black people were dying. There were more black people dying from this epidemic, just like what's happening with COVID-19 today. And that's why I say how this epidemic is similar to COVID. For instance, the comparisons to COVID could not be more stark in relationship to the fact that fewer blacks were being infected by the 1918 flu epidemic, but those that did most likely died. So, for instance, with COVID, as you can see on this picture here, 6 black patients denied tests, then died from coronavirus. This happened at the beginning of the virus too, as well. These people were basically sent home and to die. So, for instance, a lot of black folks don't have that luxury of being able to take time off and going to the hospital and having free time like a lot of other people. And the bulk of black people who have jobs are essential workers, so they basically have no choice. So this is what that's why I kind of compared the two between COVID-19 and this epidemic, where black people are basically treated not treated with respect and basically sent home to die. And the same thing with the Tuskegee experiments, where from 1932 to 1972, the U.S. government authorized tests for poor rural blacks in the South to be tested for untreated syphilis, known as the Tuskegee Syphilis Study, and the U.S. Public Health Service and the CDC, and they tested over 400 poor blacks, and the so-called purpose was to observe the effects of the disease when untreated. And 40 years later, medical evidence showed that it was completely treatable. And the thing is, this went on for 40 years, from 1932 to 1972. And it was basically a sham type of thing that was created by the U.S. government, in which over 100 people died, and they were told that it was fine, so on and so forth, but it clearly wasn't. So again, this is another relationship that I make between this and COVID-19 and how Black people have been misled, into these types of experiments where Black people's bodies are used for the betterment of whites. Henrietta Lacks, for instance, this is another one of my subject matters. Henrietta Lacks contributed to the cancer cell revolution without her consent after being admitted to Johns Hopkins Hospital in Maryland. And her cancer cells were used to develop the HeLa line of first immortalized human cells that have been saving lives ever since. And could this be compared to the experiments on enslaved Black women? In some ways, yes, I would say so. Just because back then they didn't have to get consent, and at the same time, Black people weren't exactly welcomed into hospitals. And this was in Maryland too, which was still kind of south in some ways. But this is what we talk about when we talk about how Black bodies are used for the betterment of everybody else except Black people. And she went into the hospital for a tumor, and it was rare for hospitals to admit Blacks in 1951, especially way before the Civil Rights Movement. But Henrietta Lacks was a pioneer, but her cells were used without her consent. And just like with the AIDS crisis, in 1979, a strange new disease was detected in San Francisco and New York City, which primarily affected the gay community. It was HIV which led to AIDS, and the effect on Black people was immense in that it was treated by the medical establishment as Black people and their hygiene and sexual habits were reasons for the infections. And just like COVID-19, the stigma attached to the disease applied to gay people and also being Black and gay saw large numbers of hospitalization and racism. Just like with COVID-19, no transportation to go get treatment, no access to drugs that treat HIV. More Blacks die from a lack of treatment from the medical establishment, and the death toll for Blacks is way more. And this was in the AIDS crisis. It's still happening today, so it's not like people aren't still getting AIDS. But it happened. This happened in the 1980s, in which thousands of Black men, it was treated as a gay disease when it really wasn't. And when it started affecting everybody else, that's when everybody started paying attention to it. And Hurricane Katrina, as you know, hit New Orleans in 2012, and the city was completely underwater after the levees broke and caused a human rights disaster, and that over 1,800 people died, and Blacks were left to fend for themselves. And once they got to the Superdome, it became a petri dish for those with pre-existing conditions, and also cardiovascular diseases ran rampant with feces and vomit in the Super Bowl. So this is another example of how Black people weren't taken care of or treated as citizens. They were basically called refugees in their own country. Hurricane Katrina was Black America's one of the Black America's worst nightmares, in that they had to wait 2 weeks in order to get help from the U.S. government, and to this day it's still messed up, and the levees broke. And this was another example of no one really caring basically about what happened to Black people during a natural disaster. So that's why I compare the two, between Katrina, for instance, and COVID, and what was happening during Reconstruction in terms of Black people's health. And Obamacare, my reasoning for equating Obamacare to how former slave owners did not feel responsible for their former slaves ties into the angry and racist reactions to President Barack Obama's introducing healthcare coverage to millions of uninsured Americans. And the mindset is that Black people are getting something for free from white taxpayers, when the bulk of the signees for Obamacare are white and poor. Plus, it took a Black president to create this law, and those in the medical profession were against it as well. So Obamacare, as an example of the anger towards the Black president, for instance, that a Black man would do something that help people, but it helps everyone, but it's looked at as like only helping Black people, and that's not the case at all. And again, COVID-19 has killed more than 50 million people worldwide, but Black people in the U.S. have died more than whites. Just as in the 1918 flu epidemic and the AIDS virus, collectively, more Black people didn't have access to the vaccine, and more Black people have been misdiagnosed and sent home without a test, even when they have shown clear signs of infection from COVID-19, and still sent home anyway with no help at all from nurses and doctors who told them that they are not a priority, but other white patients, even those refusing the vaccine, are given priority over Black patients and everybody else. And in conclusion, I was going to, my rephrased thesis statement is that going back to Reconstruction, how freed blacks were ignored after they were freed, and former owners felt no responsibility towards their former slaves, and up to the present day with COVID-19, where the medical establishment continues to ignore black patients who are dying at an alarming rate. And that's the purpose of this project for me, is me saying basically that some things have not changed in all this time of between Reconstruction and now in terms of black people's health. When it benefits everyone else, they can be experimented on. But when it comes to their own health, they're not seen as a priority. And that has always been the problem. And that's how I've always been able to equate the medical system with slavery, in that a slave who's not well isn't good for profit. And that's one of the reasons why um, black people who were freed, especially, had to open up their own hospitals and so on, because they just weren't getting help from the medical establishment due to racism and Jim Crow and laws written that specifically kept black people out of the mainstream when it comes to their health. So my job, my thing with this project is that I really would like to create a better medical outcome for black people in America. That's kind of like my goal with this project, is to create better medical outcomes, so we can prevent the next epidemic from happening. So we can prevent the next COVID-19 epidemic from happening again. Thank you very much. I appreciate it. Thank you.